Receding gums don't just affect older people. The American Dental Association says half of Americans between the ages of 18 and 65 already have some degree of gum recession. And the treatment's usually a gum graft. But now there's a new, less invasive procedure. Dr. Chow and Dr. Goldenman join us now live with a look at that. Good morning to you two.
Good morning.
All right, first let's start out with why should people care about their gums and receding gum lines?
Well, one of the things that really affect people when their gums are not in the right place, it can affect their smile. People's lives are actually affected because they just can't smile, they can't feel confident. And of course, when there's gum recession, there is sensitivity sometimes, and if it's untreated, it can cause eventually a tooth loss. But these people are caught in the horns of a dilemma. They have a problem, but the fix is kind of drastic. There's the gum grafting technique, which calls for us to cut the gum from the palate, from the roof of the mouth, and stitch it to the place where it's needed. And so being caught between having a lot of pain and just keeping with a smile that's not so attractive, some people just grin and bear it, get it done, or just live with a bad smile.
Yeah. Well, a lot of people don't like going to the dentist at all, period.
Yeah, right.
Having a gum surgery and cutting it open, like, oh, geez, just thinking about it gets me, you know.
Yeah. So now we have a quick, easy, and huggable way. Treating this. It's like surgery without surgery.
Oh.
We can move the gums down through a pinhole, and we don't have to cut. We don't have to sew.
Wow.
And the results are instant. You know, you have gums receded. When we're done with it in an hour or so, it's back down where it's normal, and there's no stitches, there's no evidence of cutting, and it's an instant fix. This is one of the most exciting things that's happened to dentistry in the last 25 years.
Yeah, that is huge. Can you compare kind of the old way versus the new way?
Yeah, the old way, you cut it from the palate, you stitch it, and with this way, we go through a pinhole with special instruments. I'm generally not as nervous as that.
Yeah.
So now this is the old way, so it's kind of replaying itself.
Oh my goodness.
That's fine. So that's the old way.
So now
this is the new way, and it works really, really well.
Oh my gosh.
And it's something that's, and then we make sure it stays that way with collagen.
Oh, so you insert collagen after the fact.
Yeah, so we don't have to do stitching.
Okay. Dr. Goldberg, you know, you have brought this treatment method into your office. Why did you choose to do so?
Well, just like Dr. Chow mentioned, you know, recession is a huge issue that I see all the time in my practice. And I practice in Ventura, you know, with my father, Joel Goldenberg, and for years we've been referring patients to have the traditional procedure done for the grafting, and most of the time they would never go. They were afraid it was going to be painful, or if they did have it done, they didn't want to have it done again. So once we found out about the pinhole gum rejuvenation technique that Dr. Chow invented, we were thrilled to be able to offer this to our patients. Actually, most recently, we had a patient, Linda. She was in her 50s, couldn't smile anymore. She was told she needed the grafting done, and she didn't want to. So she went online, found that we offer this procedure, and she's thrilled. She can't stop smiling. Actually, immediately after the procedure, we gave her a mirror. She looked in the mirror and she almost started crying. She was just couldn't believe it. For years she couldn't smile, and she was just happy because instantly it was looked exactly how she wanted to, like nothing had ever happened. There was, like we said, no cutting, no stitches. Really, like she never even had surgery.
Wow.
It's pretty amazing.
So she's one of the many patients that go through this. Dr. Chow, can you kind of explain what a patient goes through when they have this technique, you know, for those that might want to go get this done?
Yeah, well, it's quite simple because the gums are numbed up, and we put a tiny little pinhole above where we want to treat it, and we use specialized instruments that I invented. And basically lift the gums from the underlying structure and kind of just let it drape down to where it belongs. And then because it's still a little loose, so through the pinhole, then I would put collagen underneath it, and then kind of stabilize the gums where it should go. And because there's no stitching on it, and there's no evidence of cutting, when the patient smiles, it looks like the gums are at the right place. And so it's like it's totally rejuvenated.
Wow.
It's like surgery without surgery, as one patient says. So we do get a lot of hugs It's quick because it takes hardly any time. It's easy on the patient because there's hardly any pain and hardly any downtime.
Yeah, totally.
And then it's huggable because we dentists would do it, 850 of us, but by now in the world. In about a year and a half, we trained that many, and we get a lot of hugs.
And we have a before and after pictures, I believe, here that we're going to show. Look at that. Wow.
Yeah, that's on the left-hand side. We did the full mouth, upper and lower, in less than 1 hour.
Oh, my goodness.
Upper, we did this also in less than 1 hour. It changes people's lives when this kind of thing
awesome.
is done for the patients. And they often say, you know, this is like surgery without surgery. This is like a miracle, they'll say. It's like magic, Dr. Chow. How do you do this? And we are just so thrilled that we can bring this method to the public and through the dentists who are trained for this.
Yeah, I'm sure there's different prices everywhere, but I mean, Dr. Goldberg, for example, quick last question here. How much does it cost, and is it covered by insurance at your office?
It does. You know, it varies depending on the type of insurance that you have, but most insurances do cover a portion of it, and it's actually done by tooth, by site, so it can vary from about $1,000 and kind of works its way up.
Okay.
But definitely right around the same range as the traditional procedure.
All right.
Exactly. Yeah.
There we go.
We can do it actually because we can do so many at one time. We can actually charge much less than the grafting. It's much less downtime for the patients too.
Awesome. Dr. Chow, Dr. Goldberg, thank you so much for joining us this morning. I feel so excited about a new opportunity to do surgery without actually doing surgery.
Yeah, exactly.
All right. Thank you.
Thank you for having me.